So there are 6 things you should be aware of if you have an ACL injury and are planning to undergo a surgery. First, the best results are obtained if the surgery is done early after the initial inflammation is settled and the initial rehabilitation is done. Injuries which are years old, let's say 8 or 9, 10 years old, have lesser favorable results compared to more acute injuries. Second, prehab before the surgery. Prehab strengthens your muscles and helps you recover post-surgery. Third, the technique used for the surgery. So we used a special technique called all-inside ACL reconstruction, and in selected patients we do fiber tape augmentation, which ensures a faster recovery. Fourth, additional procedures. So if you have associated meniscus injuries, addressing them, repairing those meniscus injuries leads to a better long-term outcome. In contact athletes or in athletes who are playing sports, we do additional procedures like fiber tape augmentation, or we do iliotibial band tenodesis, which will decrease the risk of a re-tear. 5. ACL rehabilitation. So that is the most important thing affecting your recovery. Last but not the least, number 6, ACL re-injury prevention program. So